sign? Circuit. I don't know. Hi, we need someone right away off of Circuit Street. It's a guy in his 50s, and he needs support right away.
Yeah, how you doing?
I don't remember fear. I remember thinking I may die. Next thing I know, I was waking up in an ambulance. A very surreal surrounding. There was lights over my head. The EMTs were in the air going, Mr. Flanagan, Mr. Flanagan, you're a lucky man. You just had a heart attack. That was a crazy day. I left my wife. She went off to a soccer game to go see my grandson, and I went down to my shop to go kind of clean up a little bit and fertilize the grass.
My son's soccer was here, and so we were coming down for his soccer practice down this road. And then, like I said to you, I saw you fall. Yeah. Within seconds, we realized there was something really going on. So I called 911. My friend Jackie, who performed CPR, she just instantly
Jumped right on it.
When we arrived, we witnessed police officers and some civilians working on a person that was laying down on the ground. We made a decision to transport him into the ambulance and then depart the scene and head to South Shore Hospital.
A lot of noise, a lot of things were happening to me. EMTs were cutting my clothes off, and putting monitors on me.
When we arrived to the hospital, I remember running in and asking for my husband into the emergency room.
It was a very frightening time, probably the most frightening time of my life.
We knew everything about what had occurred. The cardiac cath team was able to take him immediately to the cardiac cath lab.
His doctor, who was absolutely fabulous, Dr. Zucker, he ran through what was going on and what they were going to do in a very clear way that I could understand. He knew that I was probably in a shock. All my fear went away.
Anything that I do is really a we do, because it's the activation of an entire team. When people have out-of-hospital arrest, you're quite worried with his symptoms that it's an acute heart attack or something related to that.
I remember being a little nervous in the operating room, but it went very fast, and I kept saying to myself, this will be over. This will be over at some point. And it was.
The best thing we can do for the patient is if we work as a team. I have a rewarding experience after taking care of a patient that suffered a cardiac arrest would be able to see them through the recovery. Moving to the new ICU in September or October is going to impact all the patients, all the families, and especially the whole team. I think it will be very streamlined. It will enable the nurses to perform the duties they need to do and the interventions required.
I'm 58 years old, and I've been relatively active my whole life, and you don't think this is going to happen to you. You thought I'd just keep going in life, and it didn't really take care of myself.
Jay is a wonderful patient. He's looking for guidance from us. You only have one heart, so it's important to help patients take care of it.
There's absolutely nothing better than helping patients, and it's a remarkable gift to be able to save somebody's life.
There was a lot of stars that lined up that day, from bystanders and citizens till the police arrived, till the EMTs arrived. If my caregivers were in this room right now, I'd want to give them all a big hug and a kiss. They were fantastic. I love them all. I love them all. South Shore Hospital is rocks. They're the best.